Okay, I'm back again. I'm on the tail end of my workout. Okay, wow, I'm getting it in. How many of you know that to be disciplined enough to walk every day? I'm going on 59 years old. I'm a heart patient, and to put foot to pavement every day is not easy. Okay, so I would like to encourage someone. You know, no matter what your situation is, wow, get up and get out and work out, okay? Because it's very important. Um, I posted a question on yesterday in reference to health awareness, in reference to our family, the Darden family, okay? And many of us suffers with diabetes, type 2 diabetes, chronic illness, okay? And trust me, type 2 diabetes, wow, in most cases we bring it on ourselves, okay? We really do. I am a type 2 diabetic. I basically have it under control. And many of our families as well, somebody did say that high blood pressure runs in the family, but high blood pressure runs in most families, okay? And you can help that with your diet and exercise as well. However, we need to know that heart disease definitely runs on the Darden side of the family. If you do your history in reference to the family, many of our family members died of heart failure, okay? In some cases, it's preventable, and in some cases it's not, okay? But many of us go and not knowing that we're heart patients, and I'm telling you, it runs in the family. And ladies, I would like to tell you, listen to your body, because our hearts, our bodies is a little bit different than the men. Okay, our symptoms is different than the men. Okay, even though I have a defective heart valve, when I had my baby girl 24 years ago, I did go into congestive heart failure. Okay, so that was about 24 years ago. She only weighed like 2 pounds and some ounces. That's my baby Tiana. However, last year, around this time, okay, in March, I'll never forget it, I went into congestive heart failure. My heart was beating at about 15%. Okay, so I was at death's door. Yes, I was. Okay, but God is so good. But let me tell you what my symptoms was like. I have bronchitis every now and then. I'll have to use my inhaler. Very rare. But this particular time, I was a little short-winded. So I'm like, okay, let me use my inhaler. My inhaler didn't do nothing, okay? So I went to the doctor, went to the clinic, and they gave me a treatment, They put me on a nebulizer, and the nebulizer didn't do nothing, okay? But anyway, just to make a long story short, I was in congestive heart failure. Yeah. And I was hospitalized for basically about 10 days, okay? They did not let me leave that hospital without a defibrillator. So if you see this battle scar right here, I love my battle scars. It's okay. This is where my defibrillator is implanted in me. And for those of you who do not understand what a defibrillator is, okay, the defibrillator is just sitting there waiting for my heart to go off rhythm, okay? So if my heart goes off rhythm, I don't have time for nobody to call 911. If I lose oxygen to the brain in 3 minutes, I'm dead. So I have to have me a defibrillator. So that's the purpose of a defibrillator versus a pacemaker. My heart beats on time. Okay, I don't need anything to help my heart beat. You know, so I'm good with that. But so far I have not had another episode. But like I said, it's just sitting there waiting for something to happen. Okay. Diet and exercise is really great for your heart. Okay. Just because I have a defibrillator don't mean that it does not mean that I can't walk. You know, we have our moments, but I practice eating healthy. I've always walked forever and a day. I've always walked. Anybody that knows me know that I've always exercised. So that's not an issue. In reference to myself, in reference to my defective heart valve, my doctors think that I was born with a defective heart valve or whatever, you know. So in reference to heart disease, in reference to myself, I cannot say that it's chronic because it's something that I did not do right. Okay. But I just thank God at a young age, 35, that I found out that I was a heart patient, because therefore I know how to treat myself. I know what to do as far as diet and exercise. Many of us don't know that we're heart patients. So y'all be sure to go to the doctor and get your checkups, because that's very important. You want to get your checkups, okay? Blood pressure, you want to keep that under control. In reference to your eating habits, I trust me, y'all. As we get older, we cannot eat the way that we used to, okay? That fried foods, okay? What we used to do in our 20s, can't do that now. When I'm approaching 60. We can't do that, okay? We have to eat differently now. So be mindful of what goes into your body. You know, bake a lot of your foods. They're grease. Many of you like cheese. Cheese ain't good for you. It's greasy, okay? That grease, that cholesterol, you want to keep your numbers good, okay? But I just wanted to share that with you, that in reference to heart disease and diabetes on the Darden side of the family. Oh yes, oh yes, oh yes. It runs deeply in our family, okay? Many have died from congestive heart failure. You know, many have lost their limbs in reference to diabetes. And a lot of this stuff is preventable as well, especially with the type 2 diabetes. It's hard, but you have to work at it, you know. We have to blame ourselves in a sense. And sometimes, you know, we only know what we was taught. But, you know, when we know better, we do better. So, young or old, I don't care how old you are. A lot of times people look at me because I'm small framed. They wonder, why does she exercise? Okay? But, you know, I was exercising even before I even knew I was a heart patient. I've always exercised. As if I was a soldier, they say. But I've always exercised. But I've always felt that in order for my heart to get any kind of exercise, I got to move the body. So, as I said, when you know better, you do better. So I moved my body. I would have been exercising even if I was not a heart patient, because that's what I've always done ever since especially ever since I had my first child, going on 38 years ago. I've always worked out and exercised. I really have. People used to ask me, "Are you in the military?" Because I was just that disciplined. So, and exercise, I truly believe, have saved my life as well, because I was 35 years old when I was diagnosed as a heart patient, and they told me exercise is my medicine. You know, they was really shocked as far as like how young I was, and was experiencing what I was experiencing. You know, when they diagnosed me as a heart patient, being in congestive heart failure. But they was really excited because all the muscles I had from walking, and I'm telling you, it's very important. But anyway, I've talked long enough. I'm going to say bye for now. And in order for the heart to get any kind of exercise, you got to move the body. But for health reasons, I felt that it was very important for the Darden side of the family to know that heart failure and diabetes are chronic diseases that definitely runs in our family. So be sure to get your checkup. I love you guys. Bye for now.